Good afternoon, ladies and gentlemen. My name is Mary Jo. I will be talking to you about HIV and the virus that we call AIDS. When I was first invited to talk about HIV/AIDS, I spent most of the time wondering how would I reasonably talk about something I have never experienced. Anyway, I'm sure we all agree that whether infected or not, we all have some shared knowledge about HIV/AIDS that will be important in addressing these topics. Most importantly, we know that HIV/AIDS in most part of the world has been declared a scourge because it has deadly consequences causing over 1 million deaths every year. For this reason, it is important that we make collective efforts to address and emphasize prevention rather than cure. Since we know the disease has no cure yet, in my career, I have spent years listening and trying to help HIV/AIDS victims. And sadly, one frequent regret I heard was, if only I was careful, I will not be here today. I have therefore ventured into years of research and counseling to sensitive people and well-tested and reliable HIV prevention techniques. For HIV/AIDS prevention is better than cure. In this speech, therefore, we will look at the effect of the disease and what make it incurable and make comparison to the more easy prevention mechanism with the sole aims of encouraging a more preventive approach in dealing with HIV/AIDS. Several research and studies have been conducted with the aims of discovering the cure for HIV/AIDS. However, the outcome of this research study have ended up providing disappointing results despite first showing an indication of hope in finding the cure. Efforts by medical departments of different hospitals globally and nationally to find a cure for the disease, it bear no fruit. The disease was first discovered since the disease was first discovered. Despite several alarms that the cure has been found, the trial and testing procedure have not provided 100% proof that the disease is curable. For example, some Mississippi doctors announced curing an infant of HIV/AIDS. 4 months later, 2 men in Massachusetts was said to be cured of the disease. The media hyped into a breakthrough in dealing with the virus. Finally, there was a sense of optimism. Unfortunately, in December the same year, the infant and the 2 men in Massachusetts were supposedly still found infected. Having seen how hard it has infections, this for instance, it helps prevent us from getting chickenpox for a second time. White blood cells responsible for fighting disease in our bodies to go dormant state to more information about past infection. In order to counter them in future, the dormancy state of the white blood cells allow for HIV to continue developing in our bodies. This means that by the time treatment is started, humans already have been to cure HIV/AIDS. It is important to understand what exactly makes HIV/AIDS incurable. Several factors contribute toward making HIV/AIDS incurable. By allowing the virus to multiply in the body and eventually gradually causing harm to the victim. The secret behind the difficult to cure HIV is in the cell it affected. The human body have the immunologic memory which store information about past millions of white blood cells with latent HIV in them, while drugs can prevent the virus from replicating. The latent virus is unaffected. As such, HIV researchers have identified the latent virus as the greatest barrier to cure. Encouraging some of us may still be wondering that even though HIV/AIDS has no cure yet, why is it really necessary to prioritize cure? How does the disease affect me? After all, HIV/AIDS has various signs and symptoms that result from it, including other social impact on the victim. The virus weakens the body defense, making the victim easily susceptible to other infections and diseases. This leads to the thinning of the patient. It gives these patients diarrhea, vomiting, pain, and other suffering, eventually leading to death. If not controlled in time, antiretroviral are drugs that have been innovated to reduce the health impact of the disease by making HIV/AIDS patients look and behave completely normal, despite carrying the virus for the rest of their lifetime. However, treatment using drugs is accompanied by recommended diets that may be expensive for the patient and their families, making the health care for the patient costly. Additionally, the patient may experience stigmatization, alienation from the rest of the society, suffering alone and solitude, finally, low self-esteem resulting from the victim feeling of embarrassment and being burdensome may affect the patient, leading them to suffer, not only physically, but also emotionally. Therefore, to avoid this negative impact of the disease, it is important that each and every single person as an individual choose to exercise prevention, recognizing the negative impact and the incurable nature of HIV/AIDS. From the earlier discussion, prevention of HIV/AIDS can be considered much better and easier than curing it. The late Johnson, a child with HIV/AIDS activist who later succumbed to the disease, was until his death championing for hope for the affected person and emphasized prevention despite being positive. His story was a story of hope and courage and motivation to those living without the virus to take care of themselves and consequently the people around them. HIV/AIDS prevention is less costly and easy. It could be done using any of the following techniques: responsible sexual behavior such as faithfulness to a single sexual partner and exercising abstinence, frequently getting tested for HIV in order to protect yourself and other people you care about from getting the infection. Use of protection such as condom during sexual intercourse with people one is not sure about their status. Avoiding blood contacts by using protective gear when handling and dealing with blood and accident situation. Expected mothers, get to talk to your doctors. Get prescription drugs to avoid affected mothers to babies. Conclusively, HIV/AIDS is a deadly disease that calls for prevention efforts. To these discussions, we have found out that research to identify HIV/AIDS cure has so far been futile. The nature of the virus allows it to continue growing in the human body, making it difficult to treat. The disease has a various negative impact that affect in human life. However, prevention is easy. The most appropriate way of dealing with the disease is the easiest way of dealing with the disease. It is therefore each and everyone's responsibility to take care of themselves and help eradicate the disease. with the aims of assuring ourselves of health, safety, and security, which is one of the basic human needs. I urge you today to use what we have learned today to take care of yourself and the people around you and your community. Thank you for listening, and I'm open for discussions.